Welcome everyone to Office Hours. I'm Stuart Newsom, and today's episode is all about growing influence of AI agents and automation in revenue cycle management and how they're actually driving success for healthcare providers. So, as we all know, automation has long been a game changer in RCM. It's been around for years. But AI agents are taking things to a whole nother level. So, in today's session, we're going to actually have a discussion on the real world impact of AI driven automation, explore common challenges and solutions, and also look ahead to what's next for healthcare providers who are adopting AI powered tools. So looking at those forward thinkers. So joining me today, I have a very experienced person who's been accustomed to selling automated solutions in the hospital space is Stephanie Solich. She's our Regional Vice President of Enterprise Sales here at Infinix. And again, she has a lot of experience working with hospitals and health systems. Mainly, it's all about optimizing your revenue cycle operations, right? So, in part, automation has grown. There's been certain key effects along the way to improve those workflows. So, she's here to share those insights on how AI agents, in particular, are reshaping the way providers manage claims, improve financial stability, and optimize staff resources. Now, Stephanie, I just want to ask you, how you doing today?
Pretty good. I'm visiting you from Cleveland, Ohio. Our weather is terrible, but outside of that, I'm very good. It's 35 degrees and gray and gross, but
Wow. I would make you jealous, but I'm down here. I'm in Alabama, and as you can tell from my accent, but it's a good balmy 71, 72, and sunny. So
it's
uh,
like a dream. That's a dream.
yeah, yeah. So it's awesome here. It's awesome here. So awesome. Well, maybe sunshine's coming your way. It's going to warm up here pretty soon. Spring is in the air. So
Yeah, yeah. We'll talk again in July when it's like beautiful here and too hot down there.
yeah, it'll be 103. Right.
Yeah.
But before we dive in, I want to just remind everyone, anybody who's ever been on office hours with us, we'll have a Q&A at the end. So if you have any questions, feel free to drop those in the chat below, and also comments, not just questions, but if you have any comments or suggestions or any tips along the way as you're listening to us, feel free to drop those in and I can mention those as well. So we'll address them as many as we can possibly during the session. So with that, I'm just going to dive right in and get started. So Stephanie, before AI-driven automation or before even RPAs, these bots, and any automation, and particularly AI agents, which is now the new thing, AI agents became widely adopted in RCM. What were the biggest challenges hospitals and health systems faced?
My limited opinion. I mean, I've been in healthcare, IT, front end, mid cycle, back end a long time, but still, the more I know, I feel like the less I know. So I take everything I say, well, great.
Right.
Like I realize how crazily complex this space is, and I think accessing the right data at the right time has been the biggest challenge forever. Like, and I think the AI agents and bots and all of our IT modifications and technology has helped that. But I think that's has been the biggest challenge just because there's compliance rules. There's, this system for front end, there's a system for the back end, there's this person here, that person, like it's none of it's connected. And I think, and even for I haven't been on the clinical side, but for clinicians too, to see what's the patient's history. If they went to a different facility, they have no idea, right? So just, having access to what they need at the right time, I think has been a big challenge. And CFO
Yeah.
has the worst job. Like I can't, how do you run a business not knowing when you're going to get paid or how much you're going to get paid ever?
Right, right. And especially when there's, insurance verification issues, there's, prior auth continues to be the number one denial, which to
Mhm.
me, I've said this before, seems to be kind of an oxymoron. Okay, we've got a prior auth, there's a reason to get it, so you can get paid, and then boom, you're denied because it's a prior auth reason. But you're right. I mean, it seems like the same issues have been the same issues for years. It's just, and as we throw technology at it, and I was thinking about this the other day, it's almost like we're throwing technology at it from the standpoint of how we are doing it manually. It's almost like, you do things a certain way. There's these processes. You're so adapt to doing it that way for so long. And then when you think about adding automation or technology to the mix, it's like, okay, I want it to do exactly what I've been doing it, but there may be a better way. A lot of it is not so much technology, but also just ingenuity on how to possibly do things better.
Right,
Um,
right. Is that getting the data you need at the right point in time?
exactly,
Yeah.
exactly. So when we're looking at the solutions for this, with AI agents being front and center, and even automation of AI agents, how have this new technology, AI agents and automation, improved key RCM processes? And particularly if the ones that come top of mind are prior authorizations, claims management, and appeals, leading to fewer denials and faster reimbursement, because that's been the name of the game again for many, many years.
Yeah, yeah. So we all talk about in healthcare, talk about the accuracy gains and the efficiency gains with the agents. I think we all realize that we've heard this all, we all realize this is the case. Even if you're not in healthcare, you understand that copying and pasting a email address is more accurate than trying to remember it and using fat fingers, right? So you understand, where how agents are great. But so we know that part. But one of the things that I think is like maybe an intangible, harder to measure thing is what an annoyance um, unraveling an insurance claim could be for
Mm.
for the provider, for the patient, and that all leads to patient satisfaction. And so I said you can't really, put a data point on that, but it does add to the whole healthcare experience and time managed and time cost and that kind of thing. So if the agent can help alleviate some of that, like, I don't know what to do with this claim, or why is it denying, and like, because they're so complex, if anything an agent can do to help that, like, that makes an agent like a true hero.
Right. Oh, absolutely. And even these processes have been around for a long time. I've, been associated with some companies, and partnered with some companies that have built in, certain rules, even if it's a claim scrubber, or even if it's, pulling data from an EHR into a charge capture and kind of capturing, maybe something that needs to be corrected, and it automatically corrects it for them. Those kind of things have been around. Part of the issue is, and I just did like an RCM minutes episode on this, but part of that problem is those systems they have to be programmed, if that statements sort of stuff.
Mhm.
And so if something's broken, if something doesn't quite break down, then it breaks down, if it doesn't receive the right information. Whereas an agent is actually using Gen AI and starting to reason and understand, if something's broken, like if you move, say, the name of a patient to another area of, say, a portal or a website, it's going to be broken if that change has been made, because it's looking for that field in that particular place.
Mhm.
But AI agents are actually going to know, oh, wait a minute, this has moved. Let me look for it. There it is. I'm just going to put it in there. And that's just a simple analogy, but AI agents are able to reason. And when I say that, I don't think people realize the impact that's going to have, because the typical practices have been, you have to program it, and you still have to do with machine learning models and things of that nature, give it knowledge, but then it learns on its own as well. So I think that's going to be a big game changer in influencing, the RCM operations.
Yeah, and I'm looking forward to when they can get in my inbox and not just summarize an email. Like, I want them to do things too for my personal email, right?
Right. And that's what I did. And that's your automation thing then, probably. I like it. But and where I'm coming from, I was recently at the Southeast, and you were there too. We were both there
Mhm.
together. And I led a panel for the Southeast HFMA symposium. And just as an icebreaker, I asked everybody on the panel, if there's one thing you wanted to automate, what would it be? And you just nailed it. I think I would be on top of that as well.
Yeah,
So awesome.
yeah, there is a new, like, Apple has that new, it summarizes, AI will summarize your email or your
Mhm.
text, but I wanted to take the next step. We'll get there because we're doing
Yeah.
this is more important. Healthcare is more important, but then next
Yeah.
is my Well,
Clean up my email because of my junk
yeah.
email. Yep. Well, and also looking at operational efficiency here. So, what role do AI agents play in optimizing labor administrative efficiency? How has healthcare providers successfully integrated them into their workflows? And we're talking about, obviously staffing, organizing that operations, how things get done, so to speak.
Yeah, so I think the biggest thing for efficiency and optimization is, us not having to use our valuable brain power to remember which payer requires a certain modifier, which payer requires special documentation. It's been 48 hours since I sent this prior auth, like yada yada, like all of these complex things that we know go into getting something paid in healthcare. Um, and there's many ways that AI and agents can work in healthcare, but one of the easiest successful ways is to have the agent do as much as it can, kick out the exceptions. The human does, the things that it doesn't understand yet and provides that feedback loop. And,
Mhm.
the more it goes, the more it learns, just as you explained, um, it gets better as it goes. So,
Right, right.
but at the beginning, it's, just saving ourselves from the things that don't need to take up space in our brains.
Exactly. It's kind of working by exception. I think we've
Yeah,
heard that
right.
term before, and everyone is kind of using that, but it's absolutely true. I mean, there's a lot of things that we go through our lives. You mentioned the email analogy earlier. Depending on the morning or all throughout the day, I probably spent a good, hour, and that's probably being very conservative, just, managing my emails, deleting, you know, and I even have filters. I've already got it where there is automation in that analogy where it's going to certain folders and I can go and look in those folders. So I am taking advantage of that, but it's really looking, like you said, clearing that headspace. So if we can have an agent who is understanding, not just programmed to go through the process, but actually understand exactly what's happening here and reason it. And may take a crew of agents to accomplish. And then it allows the human agent, so to speak, to focus on those more complex issues.
Right. Yep, exactly. And I've seen that Apple inbox with the different folders. It's gotten better even in the last month, like as I delete things and move things around. So
Oh yeah,
watch
yeah,
it next.
awesome.
Yeah.
Well, and of course, the name of the game is the financial impact.
hmm
So, and looking at that from maybe an ROI perspective. So, how do AI-driven automations and agents improve financial predictability, or I should say predictability, revenue cycle stability, as well as cash flow forecasting, for providers?
Yeah. So one of the things that I think about is that every human is complex, and that's wonderful and fantastic, and that's why we can work on the exceptions and that kind of thing. But a human resource is also complex, where they might get annoyed that their boss asked somebody else to do something, and then they're like, I'm not doing as many charts today because I'm annoyed today, or something else is going on in their life. Whereas the agent, doesn't care. They'll work 24 hours a day.
Hmm.
They're not, trying to go to LinkedIn to find a higher paying job. They're, all of these things that we have. So it's much more, like you said, predictable, and you can, you know what's coming, how to, uh, you know, account for your agents
Hmm.
more easily than all the complexities that come along with the human
Right,
resource.
right, exactly, exactly. And to your point about, not taking breaks and everything, and I know like an RPA, and it still is really cool how an RPA can actually automate a lot of that stuff. But still, an RPA doesn't necessarily work faster than a human. It does where it doesn't get distracted. It's got
Mhm.
its head down. It's saying I'm doing this task, but it still takes the same actually do that task, and it's not multi-thread, so it's only one task at a time unless you have multiple bots like that are performing that. But AI agent, very different. So I think AI agents are not only going to be reasoning and processing this information more efficiently, but it's going to be much faster. I mean, I've heard reports where, tasks that take, up to 3 minutes and people, 3 minutes, that's not a long time. Well, it is if it adds up, but now
Mhm.
reducing it down to mere, maybe 30 seconds or less. So that's a huge, huge swing. And it's the agent taking that time, not the human agent taking that time. So I think from that standpoint, just people are so focused on, your net patient revenue, your denials, and the revenue it takes to get those denials. But then you think about how much it costs to rework a claim. You
Mhm.
could have agents do that work on the vast majority of reworking those claims, could reduce that cost to collect. You could also have situations where the agent is doing preventative, where it's recognizing, hey, this is going to be a denial. We've seen this before.
Mhm.
Correct this and correct it automatically. So again, going back to that, where it's taking that complexity, where the human agent can handle more complex cases, so to speak. So now talking about adoption and some of the best practice, and I know you've you've very experienced in this, even where there's been some manual processes. It's all about process. So as hospitals and health systems look to implement AI-powered automation and AI agents, what are some common pitfalls they should probably avoid? What are the best practices, if you will, that they should follow?
Yeah, there was an interesting one I heard about at Vive just a couple of weeks ago with it's a healthcare IT conference, where somebody mentioned this is something I didn't think about, and this is why I'm mentioning it here. We're trying to like, spread the word of things that are that are new and different. Um, is that, we're trying to get rid of the repetitive, boring tasks for people,
Hmm.
but we might take that too far sometimes where, like a human going through their day, if it's all complex, really, brain heavy load
Hmm.
all day, week on it, if they're getting all of the complex exceptions, they might get a little burnt out. So having
Hmm.
that balance of, and I don't know what the answer is, like this is a complex issue too, but just something to think about when we're, devising workflows. Um, maybe, and I said, not to give humans like back the easy tasks, but like trying to figure out a good balance where they have some lighter things and some quick wins throughout the day and the week too, and not just all the really heavy lifting, difficult things to do because AI has already done everything else.
Right, exactly. And yeah, to your point, I mean, the RCM process, as we all know, is a very complex machine in and of itself. You even alluded to it earlier, how there's just even within itself there are silos on the front end, mid-rev cycle, and then on the back end, and even into the collections area, where you're trying to collect money from the patient. So it's very complicated. And to that note, you say people can get burned out very easy, just kind of going through and being overwhelmed. But yeah, if I think that's where AI agents are different, or even better, a far improvement over your typical automations that people are thinking of today. And this is kind of a mind shift where you have automations, but the agent is again takes it to the next level where it's helping with that complexity. But it's so complex, it's not going to be 100% catching everything. It can be some part. So to your point, I think one thing that could help alleviate that issue would be, kind of what's happening already, here at Infinix, where it's not necessarily a complete complex case, but it just could be something like, we do a document capture and we're extracting data and we couldn't extract all the data, or maybe there's criteria where it needs to be audited and checked. And then that human agent is actually coming behind and saying, okay, it's missing a phone number. I can put that in there real easy. Or I'm just going to check and make sure the data is all correct, because you do need to check these agents often,
Mhm.
for compliance issues, for revenue issues. Just like you would check the performance of an employee, you need to check the performance of these AI agents.
Yeah. Yeah, the auditing is still that's going to be a thing forever, right?
Hmm. Right.
Until
So
we
you
get
just,
an agent that can audit,
yeah, yeah. Oh, yeah, exactly.
maybe.
An audit agent. That's a great
Yeah.
idea. I'm sure someone's already thought of that. That's awesome. But also, and then kind of looking ahead, because that's a good segue. you know, what is the future of AI agents in RCM? I mean, I think the possibilities, are out there. Um, are there any, from what you've seen, are there any emerging innovations that could further transform provider success and reshape the way revenue cycle teams operate?
Yeah, I think it's kind of difficult to imagine because I think back my first job in healthcare as a candy striper, which is, probably an outdated term. I don't think they had my social security number as a volunteer, but I was taking pages of PHI and filing them in those big giant cabinets, which now sounds mortifying. Like there's no way anyone would do that. So, and I kind of think that AI is going to be the same thing in 5 or 10 years. Like we're going to look back and be like, oh my gosh, people were sitting there and doing this other stuff. That's crazy.
Yeah, yeah.
That's
Doctors putting the charts in their trunk, yeah,
right. Right.
yeah.
Yes. Driving them around.
Hmm.
Right. So, and it is going to accelerate quickly. The more knowledge that the AI absorbs, the better it's going to get. And like, it's just, I think it's kind of unimaginable, like
Hmm.
what it's going to be doing and what we're going to be doing. And also kind of will be interesting to watch the payer provider relationship change as both sides, have developed the technology and I know they work together, but they kind of have different goals sometimes, different, it's a
Hmm.
little bit adversarial. So I think that will be interesting to watch too, how that evolves as more, the AI is refined.
Yeah, I agree. And one thing I've noticed just in the last year has been you take coding, and I've always said, coding is the language that payers use to understand what happened at the encounter or
Hmm.
at the visit. And um, it's that translator. You have the documentation that documents the visit or documents the encounter, documents the procedure. There's diagnosis that you need for medical necessity. All that is translated into codes, which is why we have coders. It's a very complex job, very complex process. And then that's sent to the insurance company, and they use those codes to then base the premise of payments with all the policies and regulations that go with it. And what we've seen is with the request of medical records has definitely increased because payers are actually using AI agents to look at those clinical records, even go back and figure out which claims need additional medical records. Sometimes may not need medical records. They're just choosing those, and they're actually leveraging this technology to do that. But then I thought about that for a second and thinking, wow, it could be to a point where the codes had a purpose. And I'm not saying they're going to go away. I don't want to panic any coders out there. But it could be where you just send in the documentation and an AI agent on that end is going to read the documentation and then pay accordingly. So, I mean, that I'm thinking way in the future, and it may not ever happen. But I'm just sitting there looking, thinking, well, this could be a possibility. Is it a probability? Maybe not. But that's just kind of where my brain goes when I'm thinking, wow, this could evolve because we're doing things now that we couldn't do 6 months ago.
Hmm.
And what are we going to do 6 months from now? And it's just going to get better and better and better. There's already conversational AI, where an agent is actually having a conversation. You can't even tell very slightly that it's even a machine talking to you anymore because that
Yeah.
machine is actually asking questions, figuring out things for you in that conversation. So you can imagine you don't have to call a payer anymore. You could have an agent call the payer. I mean,
Right, right. And their tone of voice is getting
mhm.
better too, where it was very flat before, and now they're like no asking a question with a little lilt at the end. So all of the things where you can't tell the difference so much anymore.
Right, right.
Yeah.
So you never know. I mean, that's just. I mean, this is all speculation, but
Yep.
but some of it is. I would have thought was speculation what we're doing today. Uh,
Right, right,
so yeah,
exactly.
yeah.
Yeah.
So you just never know. Um, well, that's really all the questions I have. I'm going to now turn it all over to some audience questions and see. Let's see if we have any down here. One that we have is how can smaller hospitals and independent providers leverage AI agents without the same resources as larger health systems? That's, yeah, I guess like your rural health. critical access hospitals, maybe, some smaller, just smaller hospitals.
Yeah, or even maybe a mid-size hospital that's just starting out too. I think it's so overwhelming. I've sat in meetings where, like it's like a white piece of paper. We're like, where can we help you? And they're like, everything. I don't know, right? So um for anyone who's just starting out, or if you're a smaller facility, to maybe find somebody who's got a menu of automations they've already done before that are successful. It's something to start with, it's starting to look at, and then you can customize from there. It's also great for a smaller hospital if you have somebody who has their own platform, so you're not waiting in line behind the bigger systems who, kind of demand a little bit more attention. Right? So,
Right, right, exactly, exactly. And so, and I would say also kind of start small.
mhm.
It's kind of take a modular approach. Kind of look at it from the perspective of you don't have to, eat the whole elephant at once, right?
Right.
So you just kind of go in there, gradually work. And the thing about AI agents, and this is a point I heard the other day, is when you hire someone to come in and help with your job, because as you grow, maybe there's some acquisitions, maybe there's some growth in the practice or in the hospital setting. You hire someone, you have to train that person. Even if you get someone that's experienced, they got to understand and get used to the culture, get used to the flow of that particular hospital,
Mhm.
because they are slightly different. They're little tweaks. But that AI agent's already trained. You're just bumping up, the work capacity that I could use or adding others. It's already trained on those models, so it understands. So you don't have to go through that training process, with them. So it's just the applications are mind-boggling.
Right,
So
right. Even if there's little tweaks for your particular system, it's such a smaller lift than the somebody new coming in from an,
Mhm.
learning everything new. So
Right. I do have one more question here, and that is, as AI agents take a more complex RCM task, how should organizations balance automation and human oversight to ensure accuracy and compliance? There's the big word, compliance.
compliance is a tough one because that's changing all the time too,
Mhm.
Um, and I kind of go back to my other, couple of my other points about human, balancing people's workloads so they're not too taxed all day long. They want to alleviate some of the repetitive stuff, but maybe not too much of it, because then their day is a little bit too much brain power.
Right.
Uh, yeah, and then the compliance too. If the agent is the one keeping track of all the different compliance changes, that helps, right? Like, even if the agent is just alerting, if you're going back and checking if there's a place for, if you see something that looks off and the agent says, well, this is why, like
Mhm.
you can easily check it instead of digging through all of the rules at CMS and going and searching for it for yourself. Like, why was this kicked back? I have to look at CMS and find 6,000 different things that happen. If the agent can point you exactly where to, this is why this is, like, okay, cool, I can move on. Like, that probably saves you 40 minutes right there.
Right, exactly. And again, I think we made this point earlier, but you definitely need to monitor these agents just like you would a human agent. There still needs to be processes in place, whether you use another agent to do it or whether you're going back and finding out its findings, because if they leak some PHI, or if they over document or over code or whatever, there's all kind of compliance issues. Like, the list is long and it's always changing. The provider's still responsible. You can't point your finger at the
Yeah.
agent, nor can you report your finger to the vendor that made the agent ultimately. But you need to check the vendor out. You need to make sure that the agent's going to perform the way it needs to perform. Where is this data going to be stored somewhere? And that's a big issue. So basically, you just follow the same privacy and security protocols that you would with an EHR vendor or a PM vendor or a clearinghouse. So those don't really change. You just now have AI agents that you need to apply it to. So, well, that's it. I don't see any other questions coming in. This was a fantastic discussion. So thank you, Stephanie, for sharing your experience and thoughts on the role of AI agents and automation in revenue cycle. Really glad you joined us today. So we'll have you again.
Thank you. Thank you very much. It was fun.
Yes. So before we wrap up, just want to remind everyone that this session can be available on demand. Just go to our website. You can rewatch it. Tell your friends about it so they can watch it. And also be sure to check out our upcoming office hours episodes as we continue to dive into the latest trends in the revenue cycle optimization. So if you have any follow-up questions or want to learn more, feel free to us. And thanks again to Stephanie, our guest, and thanks to all of you for joining us today. So we'll see you next time on Office Hours.